Pediatric Ethiopia, mission number 5.
Hello, I'm Dr. Jim Cowton, cardiac surgeon, chief of cardiac surgery for Heart Attack Ethiopia. Today is our final day. We've been at MCM the entire 2 weeks, doing cases every weekday. And for adult cardiac surgery, we did 8 cases, some of which were very complex and very difficult for an institution that has never done heart surgery. They all went well. We're pleased with that. The staff here has been excellent. Our staff that we brought with us has been excellent, and I think we've all worked together well, and we look forward to coming back.
Gyanir Maharaj, pediatric cardiac surgeon here at MCM for the past 2 weeks, director for the pediatric cardiac surgery program for Heart Attack Ethiopia. What a couple of weeks. We started off from nothing at MCM, and to conceive all of the things you're going to need when you come here to do open heart surgery, to look after the patients properly in ICU, to make sure you have all the necessary personnel, all the consumables you need from gauze all the way up to cannulas to go on cardiopulmonary bypass, the cardiopulmonary bypass machines themselves. It really was a huge lift to not only conceive of what we would need, but actually get stuff off the ground and do cases. I think it's amazing. We've done 9 pediatric procedures here in the past 2 weeks. 7 of them pump cases, 2 of them closed cases, and the whole output from the team has just been tremendous. So now that we have a very detailed knowledge of what the system is, that was the other big open-ended thing when we came. We weren't sure what sort of local support we were going to have and how much we could integrate with the local team. But that's all gone very, very well, and I'm very pleased to see everybody getting together, coming together and making this work. So it really has been a tremendous experience. I look forward to our next trip here and hoping to do even more cases and have even more collaboration with the local team.
Dr. Rebecca Pilen, cardiac anesthesiology and intensive care, also program director for cardiac anesthesiology and intensive care for Heart Attack Ethiopia's training program. So I had the pleasure to get to teach and learn from these nurses and doctors in the ICU, as well as the operating theaters. We had local doctors come by and want to learn, and so we got to have this bi-directional education happen on all levels of our patient care. And just like Dr. Maharaj said, that we have truly had to think about every little thing in the ICU that you might not even think about, from, how do you ambulate this patient after their heart surgery, to, the big critical things like how are we going to get enough vasopressors and support. But we have taken, as we said earlier, it has taken all of our local volunteers, all of our international volunteers, everyone working nonstop and together to make it happen. And I know we've had a great 2 weeks.
Dr. Ashenafi Nagash, cardiothoracic surgeon and Heart Attack Ethiopia's candidate in pediatric cardiac surgery track. The past 2 weeks, it has been a great time. We have been here with great surgeons, dedicated team of cardiac surgeons, and we provided care for 17 lives, and we have saved a lot of lives. So it has been a great time. Thank you for the dedication and mentoring. Thank you.
Hi, I'm Dr. Miklol Mengistu, cardiac surgeon working at Cardiac Center Ethiopia. These past 2 weeks, we have collaborated with the Heart Attack Ethiopia team that came here. I've had the pleasure of working with the team several times before also, especially Dr. Cowton and his team. This past week, I've had the pleasure of working with Dr. Cowton and Dr. Maharaj at the MCM hospital, and I want to say it's been such a pleasure working with them. I've learned a lot, not only about the surgical aspects and the professional aspects, but also about how to work in an environment that was not tested before and how to set up everything. So it was such a pleasure and an honor working with them. I really hope that we can do this again and again in the future. Thank you so much.
We're very thankful to have been able to work here. We saw MCM last year and we're impressed with the the physical plant. I think we underestimated the amount of work it would take to implement this, but our staff has been strong. Our nurses have been extremely helpful. We couldn't have done it without them. Perfusionists, I think everybody has gone the extra mile to make this a successful mission here. Our goal was not to do a large number of cases. It was to do some cases to prove that we could do heart surgery here, kids and adults. So I think that we look forward to coming back next year and building this program here, and perhaps utilizing this hospital as one of our main hospitals.